morning. How are you doing? Thank you for staying here. Of course, it is the NTA and you are on the network service of the Nigerian Television Authority. Welcome to the conversations. Today we'll be having a very good conversation. Maybe not so good, considering the fact that we're going to be talking about coronavirus. But talk we must do if we need to find solutions, communicate, and get better in handling this particular pandemic, right? Welcome to the show. My name is Rita Abuja. It is a conversation. I'm having it with you. No, not just you. There's a full house and everyone, well, at least almost everyone is in the studio. We also have to make sure we keep social distance so you don't have the usual full couch of up to 5 hosts in the studio. I have Elizabeth sitting pretty.
Hello.
How you doing? It's been a while.
Yes. You guys abandoned me because of COVID.
Everyone is staying safe. You told us to.
It's all right. It's okay. We're back. We're back.
Okay. Our guest in the studio today is not a regular. We hope we make him a regular for some other topics some other time. Dr. Mohammed Kaur is the acting secretary. That will be Human Services and Health for the FCTA, right?
Yeah, thank you.
Thank you so much for joining us.
Health and Human Services Secretariat.
Health and Human Services Secretariat, FCTA, that is the Federal Capital Territory Administration. And of course, you are on to the conversation on NTA Network. We want to look at the coronavirus, how it all started, what the FCT is doing in Abuja, and of course, we also will talk about how it is going in Nigeria. We'll be right back after this break.
When there's a child out there that's not getting the same that your own child is getting, the difference will tell, and there will come a time in the society where that child is going to take its pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh, you know.
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys. They're not ready to marry.
Yes. If she wants to ask something, no, I know my mother very well. In fact, the most interesting one is when I put up pictures on WhatsApp, you know, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that and I
The following guidelines for eased lockdown, as announced by the Presidential Task Force on COVID-19, are effective from 4th May 2020 in Abuja, Lagos, and Ogun states. For public spaces, the following are mandatory: improvised face masks, temperature checks, hand washing facilities and hand sanitizers, physical distance of at least 2 meters, no sporting activities and mass gathering. On travel, these are prohibited: passenger flights, interstate travel except essential services, movement of agro products and petroleum products. Note, there will be mandatory supervised isolation of returnees for at least 14 days. For markets and offices, neighborhood markets are to open 3 times a week from the hours of 8 a.m. to 3 p.m. Banks and financial services are to open from 8 a.m. to 2 p.m. Government offices are open only to staff from grade level 14 to 17 between the hours of 8 a.m. and 2 p.m. on Mondays, Wednesdays, and Fridays. Corporate offices and private sector are open to business from 8 a.m. to 2 p.m. Schools, churches, mosques, clubs, bars and gardens remain closed till further notice. COVID-19 is real. Take responsibility and stay safe.
Yes, welcome back. Take responsibility. That is the one thing we all have to do. And this is our own way of also taking responsibility, making sure you get all the information you need about COVID-19. You already met our guests in the studio. Now, I think that will be 27th of February. the first index case of COVID-19 was registered in Nigeria, and of course, Abuja made her debut. Sounds like an album release, but it's not. Made her debut on the 20th of March, and it's been a long walk with all the government is doing, how the citizens are buying into the regulations and things that we need to do. You are one of the people, sir, who have been at the helms of affair, at least for the FCTA, making sure the hospitals are, up to date on what they need to do. Your staff, talking about the doctors and other health service workers, are actually up and about. Talk to us about, what it has been like since. I know it all started before 20th of March, of course. You had to be prepared like Boy Scout. Yes. Because you knew it was almost inevitable.
Yeah, thank you, Rita. It has been very challenging time. In fact, since January, when we started having the pandemic, it was an epidemic earlier, as you recall, in China. Then it started moving to Europe and other places. And the WHO now declared it as pandemic. Since then, we started becoming very, very uncomfortable. We started preparing. Then it came to our country, as you said, February 27th. Since then, in FCT, we started getting ready. We knew since it came to the country, it's definitely going to reach us. So we started putting some things. Luckily enough, in FCT, University of Abuja Teaching Hospital, Bangladesh became proactive. They fixed a ward and even sent a team to Lagos to go and co-manage the patients with the Lagos team. So when we got and unfortunately for us, we got, in this case, we were three start, as we call it in medical palace. Not one, three, the same time, the same day, the result came out. So we had to evacuate 3 people at the same time to Abuja University Hospital. So because the guys had gone to Lagos, they were ready, so it was not a problem. So we now started getting more beds, because as you know, if you have one, that one has several contacts, and those contacts also have several other contacts. So you have to do contact tracing, test all the people that have contact with 3. So before you know it, the numbers continue to rise. Till date, in FCT, we have 427 confirmed cases. The numbers have been going down of late, 5, 10, 15. At one point, we got 56.
Discharged?
No, confirmed in a day. And we lost, unfortunately, 8. But the most disturbing thing for us, in all the cases we lost, were some of the cases that did not get to the hospital. They died.
Some of the deaths were not the ones that happened at
the hospital.
Oh, really?
Now, there was a case that the wife drove to National Hospital. Before they reached the hospital, the husband died. And she was positive. She has been on admission up to now. She has not been discharged. They had done a test a few days earlier. The result came out, and they got the information, and they started rushing to hospital. The man died on their way. The other young man, 32-year-old, died in one of the gardens. And we were called. We just took sample post-mortem. Post-mortem means after the person has passed away. Whatever you do is post-mortem. So we took sample and buried him as if it were a COVID-19 patient. The result came out, it was positive. It's another person also died in his house. We got there, took sample. So there are a lot of deaths that are happening outside even the hospital.
Rita, this tells me that if you actually can get to the clinic, get to the isolation center, for me, some people actually say we shouldn't call it isolation center, we should call it treatment center, because if you call it isolation center, it makes you look like it's another way of locking you away. But that's for you to discuss and have your head with. But if you get to these places early, I think from what he's telling us that people have more like 99% chances of recovery. Am I speaking your mind?
Yes, the good thing about the virus is that the fatality case for the virus is very low, especially in our environment. Most people get out of it. Some don't even show symptoms. Some have been asymptomatic. Now, the people that usually suffer severe symptoms are the very elderly, those whose immunity is very, very low, either because of other diseases or because of their age or because of some other factors. But the general population, the case fatality is very low. So if you can get these people to the treatment centers, it's just minor things. And that is also giving us some problem because people are kept in hospital. They don't feel sick. They are strong, especially the very young, restless guys. So they start feeling, why should the government keep us here? After all, there are other people that are sick that have been there. But it's not like that. The issue is that if you are asymptomatic, you are very dangerous to the society.
Even more than the people
more than the very sick. The very sick will come down, stay in his house, But you are agile, you are strong, you don't feel sick, so you continue going for your business, and you get other people infected, and the ones with low immunity get infected and they die.
Now, considering the fact that we've recorded between 7 and, or is it 8, you said, deaths in the FCT, and from what you just told us, about 2 or 3 of these persons actually died in their house or at some other location before they made it to the hospital, or you found out about them after they had died. It then means we still have people who are not speaking up when they have symptoms that could be COVID-19 related. Definitely. What is your office, what is the government doing about this? Despite, we would have to acknowledge the fact that there are quite a number of messages are out there, but then we still have that social trust issue with Nigerians.
Yeah, very, very seriously, it's a big issue for us. Very, very big issue in the sense that there have been a lot of noise, a lot of information about this COVID-19. Using print, social media, and all other media. Still, people have symptoms or get in contact with people that they know have been infected. They don't come out for testing. Even more worrisome are those people that have been tested that bluntly refuse to get to the isolation or treatment centers. And
you wonder why?
The issue I just told you, that somebody failed, I'm not sick. Why should I be taken to a treatment center? You are the one telling me I'm sick. I'm not sick.
I know my body.
I know my body.
You say that.
I'm not coughing.
I know my body.
I don't have fever.
Somebody even told me it's only cough. And it's because
and people have been coughing all this while. And probably his neighbor is sick and is is at home, doesn't have money to go to hospital. Nobody has taken him to the hospital.
Let's play the devil advocate here. Since you mentioned someone not having money to go to the hospital, do people who get admitted for COVID-19, are they made to pay their bills? Do they get to pay their bills? Do they get to take care of themselves while they are in? You said we shouldn't call it an isolation center. What's the word?
Some people actually wrote in. And talking about writing in, you can actually follow us with this program. As you watch, it's live with the number 081 1291 4760. I'll take it again. Okay, so it's on the screen there, so you can write in if you have your questions to ask.
Okay. And that WhatsApp or SMS?
It's whether WhatsApp or SMS, we can always handle it. So once you're not asking us to send you money anyway.
All right, great. So speaking about money again, are patients supposed to pay for treatment?
For COVID-19, all over the country, you don't pay a dime. You get admitted, you are fed 3 square meals, you get treated free. If there are tests that needed to be done, they are done. In fact, in FCT, we have gone a step further. After we got into the community testing, we got some people tested and they turned out positive at Mabushi village. They are very poor. So we identified their family and called them to give them palliative. You know, we've been going around giving everybody palliative. But for those infected, well, those that need it.
Okay.
It's not people like you and...
I'll be too sure.
Yes. So we give them. So anybody that's identified and we think your economic status is not that good, we get to your contact while you are on admission. We invite your family and give them palliative. Because when we admitted some at Asoko Hospital, they really complained to the doctors that are managing them. That look, you kept us here, you are feeding us, but the families we left at home don't have food. So it's a serious issue. So we got to our authorities and we linked up with the Minister of State, Dr. Ramatu Tijani Aliu, who is in charge of the palliatives. So we designed a program where anybody that is tested positive and whose economic status is not too good.
So there's a caveat.
Yes.
It's not everyone.
No, it's not everyone.
Okay.
We link up with them and ensure that the palliative get to them. They are palliated.
You know, now you're talking about palliative and the patients of COVID-19. I'm wondering if, I actually had this experience because somebody called me and was talking about her husband being ill. By the time I asked a few questions, I quickly told her to call NCDC in her state. She's not in Abuja. So she became alarmed. I said, what is the problem? It's not a killer disease. You know, it's something that can be treated within days. Your husband will come back home. He said, neighbors will think that our own is the worst too. You know, ambulance will enter here. I said, would you want ambulance to enter to pick dead body or to pick your husband to go and get treatment? At that point, I caught up with her. She agreed. Then at the second point again, she said, but if they carry my husband, automatically I'm exposed to. They will carry me. And then what happens to our children? They're all under 10. You know, what happens in a scenario like that where a man and a woman or even a single parent, you know, test positive and the children are negative? What do you do with such children?
Yeah, this COVID-19 has posed very, very serious challenges to everybody. It's a pandemic. We've never witnessed it. You know, pandemics come once in 100 years. So everybody is learning. One of the first 3 cases we had was actually a student that came from UK through Lufthansa. The mother was supposed to come from Port Harcourt for a program here. So they agreed to meet here in Abuja. If the mother finishes her program, then they go back to Port Harcourt. So when she came, she became a contact because she came from UK, and so we were contacting and testing all those that came in. So they were in a hotel with the mother. We tested her. Behold, she became positive. Now we went to pick her. The mother said she's not leaving her daughter. And the daughter is even a university undergraduate. Eventually we took her with the daughter. We take them to Bangalore together. She stayed with the daughter throughout in the treatment center, in their room.
Or was she negative?
The mother has been negative, had been negative, till death the mother has been negative. She was staying with her daughter, nursing her daughter in the doctors before they get in, you know, they keep themselves as if they were going to the moon and all those things. The mother was in her normal, the only thing she was wearing was a mask. She stayed with the daughter inside the treatment center in the same room.
So has that lady been discharged now?
They continually tested the mother until they discharged the 2 of them. Till death, the mother has been, so we followed her for 14 days. She's been negative.
So, this is a case of a parent who was with the daughter, and like you said, is a grown child, but that motherly love will not let her let the child alone. So, but in this scenario that she painted...
Yeah, I'm coming.
Okay.
I'm coming. Just to get you a background. So, is the parents that are supposed to now organize how they think, how best they think their children will be managed. The worst is you go with your child in. If you can't live, or if...
Go with the child?
I mean, if you... There is a situation where you can even treat at home.
Oh, really?
If you have to. NCDC is trying to come out with the protocol because of certain people refuse to go to the treatment centers and they treated themselves at home. And there's nothing you can do because you cannot take a gun and go and start shooting people because you want them to go. So, but the society had to sit down and with the doctors, with the family, on how to manage each case, depending on the situation of the patient.
I won't feel that perhaps you have not been faced with a situation where you have maybe children who are probably 10 and younger and both parents are positive. Maybe we need to start planning towards that. If they happen to be in Abuja and they don't have relatives, these days the society is more of, you don't really know who is living next door, for instance. And if you have a couple who turned out to be positive and they have children that are that young, perhaps we should start making plans on how they can
take care of these children.
You can take care of them. We pray that doesn't happen, but it's a possibility.
Yeah, we pray it doesn't. When it comes, we will face the situation and meet as a team and decide how best to handle the situation.
I'm sure Doc will actually take it back to his task force and then they will plan on it. But we have lots of questions coming in. Let's see if we can take some of this. On the isolation issue, we keep seeing videos of people protesting and telling the public that they are not well taken care of. They just keep them together without anyone to attend to them, some in Ibadan, some in Gombe State. We actually have all this... I've seen a bit of this. I don't know if it's true or not. But, stemming from this, Doc, I would like to know, are there programs, psychological programs for people in the isolation center? I mean, if you're going to keep me and tell me I'm not showing symptom, me while I'm sick, you could be right, But after a while, naturally, human beings want to protest. So are there a provision for psychological enlightenment? Are there also provision for sports? Are there a provision for entertainment, to keep them busy? Like you mentioned earlier, people are restless, the younger ones. Maybe that way they can...
Doc, before you answer, last week I interviewed a survivor of the COVID-19. This particular gentleman was treated in Lagos State. And he said what was worse than him having the virus. He had very strong symptoms. He was actually on the ventilator for a week, a situation he described as very scary. He said the next worst thing was the fact that you could get depressed out of, loneliness, because the doctors that come to treat you don't even see their faces. Like you already told us, they have to be kitted. So there's very little interactivity apart from your phone.
So what the need for the psychological, talk, enlightenment becomes paramount.
Them, I don't know how we entertaining us.
Thank you. Now, as I told you, this is a very new situation, and it comes with its own complexities and challenges. In FCT, specifically, we have trained, in each batch we train psychologists, psychiatrists, and they are part of each team that is managing in each of the health facilities. From the onset, we realized that it's a very, very serious problem. Even if the person is not young, even you, or even an elderly person, you go and keep the person in. My mother will not want to come and stay in Abuja because the place is so small that everybody has gone to work. She's left in the house alone. She prefers to stay in the village. When she moves around from one place to the other, people move. So this is real. But as we continue to fix some centers. Like the Idu we fix now. We got a place where we've equipped it with table tennis, ludo, words, and all the indoor games.
That the newly commissioned
the newly commissioned. If
center.
you see it, it's wonderful. The same thing, Gwagwalada, the first few weeks, it was terrible, but we had to now fence it and do like a place where they come out, we put chairs, we put canopies, where the guys can come out in the evenings, in the mornings before the sun gets hot, they sit down and interact among themselves, you know.
Oh, that's nice.
So you just had to do that. Otherwise, it's not funny. Even you, even me, if you keep me in the house and you say I should not go out, even in my house, it becomes a problem. I feel like busting out and go.
Very true.
So we do that. We create recreational areas, and we also get psychologists. In FCT also, what we did was we got some religious people who are well educated about psychosocial treatment. We had flyers with their telephone numbers, and anybody that is on admission, we give him a flyer. The influential imams and pastors that you can call is free talk. When you call, the pastor will call back. Now you discuss.
It keeps their faith alive.
Yeah, so we discuss. Imam, this is the way I'm feeling. We now read some verses from the Quran and explain to you these things can happen to anybody. You know, read some hadiths, and the same thing for the Christian faith.
Do we also have flyers of psychologists or psychiatrists as well?
In that flyer, there are psychologists, psychiatrists, pastor, imam, so their numbers are there. You choose the one you want to. Aside the ones coming in, the fact is that the infection control procedure is that you cannot stay inside that treatment center more than certain time. The longer you stay, the more chances you have of getting infected. So the medical personnel are trained to, you go in, you do whatever you want to do. In fact, somebody is timing you that you must get out within a certain period.
Now, sir, speaking about centers and the newly inaugurated one in Idu, one of the challenges I've found out over this couple of weeks, talking about this, interviewing people and, getting responses from Abuja residents, is the fear that you have people who are positive but are not going to isolation centers or are not being treated because they are not volunteering. If we eventually do get, everyone to come to the treatment center, how much space do we have in Abuja right now? Lagos said they have space. More than half of the people that are positive are not agreeing to come to the centers. But do we actually have enough space in Abuja right now? What is the capacity of our
Thank you so
center?
much. This is the question I like because...
it made me smile.
At one point, I was jittery. And the Minister of Health said something when they were commissioning this day dome, that this day dome has removed some emotional stress of not having enough beds and thinking that tomorrow again, how many infected patients are we going to get? Why are we going to keep them? So the moment this day dome came, Idu came, that emotional stress had disappeared from us. I can tell you we have over 1,000 beds in FCT right now that are available for treatment, but I need to go details so that people don't think I'm just blabbing. University of Abuja Teaching Hospital Gwagwalada is the first place that came live, that started admitting patients. Initially we had 10 beds. We now fixed 16 because the building had been completed and it was in wings. Wing A had 10 beds, Wing B 16, Wing C 16. So they just fixed the Wing A and started admitting. As FCT, because every patient is a state patient. Any patient that is tested in FCT is FCT patient. We give FCT a PIT number.
Okay.
And that's the one up to the international, that's the court, because all these cases are reported worldwide. As you go through the internet, you see total number in Nigeria. So this thing fit in. So Lagos has its own PIN number, Kano a PIN number. So any patient in Abuja is FCT patient. It's not federal government business. It's FCT's business to ensure that that person is treated. But whether it's treated in National Hospital, in West Abuja Hospital, it doesn't matter. It's a Nigerian. So we now went in to help fix the next 16 bed. And NPC helped to fix another 16 bed. So there, 10 plus 16 plus 16, we have 42. That was the first place we got fixed. Now, National Hospital had 25, right?
Yes.
We converted our Sokoro District Hospital in emergency way to create beds. Because then the numbers started rising. We were trying to fix Karu and Idu because they were new places. It was second time. So we just packed all our patients from Asokoro to other sister hospitals and just did some minor rearrangement because of infection control process and procedure and started admitting patients there. So we have 60 beds there. Now we fixed part of Karu. We have 30 beds there. We fixed Idu last week. We had 506 beds.
That's nice.
DJ Dome was handed over last week, Tuesday.
Yes.
Monday or Tuesday. It was 300 beds. So if we had all these things, we have about 1,000
almost
beds.
1,000.
Yes. So I'm so comfortable that we
You're
have
so
beds.
relaxed.
Yes, I'm so relaxed. There were times that it's difficult to sleep.
I
As you'll be
understand.
sleeping, you'll be-
Doc, some people are still asking you questions. Let's see if we can take one or two more. Good day, doctor, or good morning, sir. My question is, if government is unable to conduct tests in the 774 local governments before the final reopening of the economy, what is likely to be the Nigerians? I don't know what, I guess you understand what he means, and he did not put his name. It would be nice if you have your name as you send in your question. Okay, this person did. I am James Bamis from Jos. Please, I want to comment on the issue of calling a treatment center as isolation center, because the word isolation is bringing a serious stigma. So we should take note of that. Thanks. Okay, we already mentioned it earlier. I told you people have been writing to ask for that. Another person is asking, are the isolation centers constructed in such a way that there is provision for the physically challenged people? Let me let you do that. The isolation centers, are they built in such a way that those who are disabled, can partake, like you're blind or you can't
Anyway,
walk well?
for us in FCT, one of the isolation centers presently is fit for purpose.
It's multi-purpose.
Yes,
Okay.
because we have a lifter it's a 5-floor
That would be
facility.
Didu.
Yeah, Didu. So there's a lifter going there, and the toilet system there is one toilet area that is for the disabled.
Okay.
So certainly, but the other not built for purpose like Asoko Hospital is the one that we may have challenge, because but that also any disabled person can be admitted because it's a hospital. Before,
I was going to say,
so
Asoko
even before
Hospital
now,
already
yes.
had,
You
a provision.
just probably can't take them to the top floor. That's all.
Yes,
Okay.
but there's a RAM. All hospitals have RAM.
Yes.
So you will patients, you will beds up.
Okay.
So
And if it's somebody that is challenged in the eyes, there's a way of helping the person. Somebody has to be there to help guide you without fear of,
yes,
contamination or stuff like that.
we have trained several people. In addition to the core health workers, we have to train hygienists. That means those people that help assist in cleaning, taking things up, taking food. People have to take food up for them, and electricians in case the electrical problem, plumbers. Since we train so many people that...
Doc, since you brought up the issue of personnel and training, yesterday I interviewed, on radio by the way, I interviewed a medical doctor, one of your colleagues, who is with the Kefi Medical Center, FMC Kefi, and one of the issues that came up was the scarcity or lack of personal protective equipment for medical staff. What is the situation in Abuja regarding
this
that?
is also a place where I can smile, because we have...
If you're a doctor watching, you need to start sending messages.
Yes, we have, yeah, they can send message.
Yeah, he says
For
you can smile.
Yeah, that one I can smile, because it was an issue. My minister saw it in the print media even, that FCT, we don't have PPEs. And we have been sending PPEs to our hospitals. And I personally supervise those things, because it started becoming an issue. And true, it should be an issue, because you must first of all protect yourself.
Yes.
Before you start treating other people. It's not fair that a health personnel is just exposed to the COVID-19. So we have sent, and I can confirm it here on television live, enough PPEs to our health facilities, including primary healthcare centers. And last Sunday I was in Nyanya. On Sunday, just to ensure that when it's weekend, that the PPEs are available. You know, it's not just sending the PPEs. It's ensuring that the PPEs are available for the staff.
Okay.
If you send 1,000 PPEs and they are locked up in the store,
So that means in Abuja you don't have issues with
and that's why I told you I can smile.
You can smile.
Yes.
All right. With that smile, we will take a break. We hope the smile remains on doctor's face when the messages start pouring in. It is Conversations on the NTA network. Do stay with us. We'll be right back.
Coronavirus, where the nickname na COVID-19, it not be big man who sickness, so if it catch anybody, according to World Health Organization, WHO, where then they call WHO, make I show you how the disease they take spread.
Oga travel go abroad, come back with symptoms of COVID-19 infection. As he land for airport, driver go carry and come house. His wife and pikin welcome her. Cook arrange food for Oga. Houseboy and house girl pack Oga load enter house. Now so Oga begin spread this infection to him people. Driver go mechanic workshop, go spread them. Cook go open market to go buy 1 or 2 things. She go spread them too. Even house cleaner go back her house, go spread the same infection. Now so this coronavirus begin take style dey spread from family to we country people.
So therefore, make we join hands obey all the instructions wey government and our medical people don give us. So wash your hands with water and soap regularly, or use hand sanitizer. No go join body for where people gather plenty, maintain social distancing. Above all, stay una house as government don advise. Stop unnecessary waka about, so make we no spread this virus.
Coronavirus, no be only big man like me they catch you. If it catch anybody, even poor man yourself fit to get am. So make we join hand together, take stop with this deadly disease where they kill our people and they never get a cure.
Together, we go overcome if we do all the things wey dem tell us to do.
Welcome back. Conversations on NTA. What is a conversation if you don't get to have your say? Let's take more of your questions or comments. Alice is going to help us do that.
All right. Good morning, presenters. I am Victor from Niger State. My questions are: a person who lives in Niger State, can he also come to FCT Isolation Center for treatment? You'll take that later. He wants to have a choice. I mean, if I don't like the one in FCT, I can decide to go somewhere else. And another person is asking a question that I always get every day. He says, please, is COVID-19 real? You're opening mouth too. Okay, so we're continuing. Another person is asking a question. He says, you have a policy of having the markets open 2 to 3 days in a week. This seems to encourage crowding on the market days. Don't you think it's better to allow the market open daily, as this will align more physical distancing? Rather, we can place more emphasis on social, physical distancing, hand wash, and face mask wearing. Okay, so there are several of them here, but I'll let you take on this.
Yeah, presently we have a positive case from Suleja being treated at National Hospital Abuja.
Okay.
It's a Niger State case, but we are treating him here.
Why?
Because it's closer.
Okay.
And the last meeting we had with the 4 ministers, Minister of Health and Minister of State for Health, Minister FCT and Minister of State for FCT and our PAMSEX, the agreement was that we are not creating boundaries. Somebody in Karo must go to Nasarawa, Lafia to get treated. We are all Nigerians. What is only important is that the EPID number is going to be Nasarawa EPID number.
Okay.
The Suleja is going to be Niger State EPID number. But we have more than enough beds here. And wherever you are treated, you are in Nigeria, you are treated. So our disease surveillance and EPID persons just communicate among themselves.
Okay.
That I have a case in Karo. Can you send an ambulance and arrange for a bed? Now we take the patient and manage. But all the reports for the patient goes
back to the states of origin.
So that's why even when we are reporting, we say total number of admission in FCT, 50. Niger cases managed in FCT, 2.
Oh, okay.
Nasarawa cases managed in FCT, 3.
Okay.
Yes.
So what we have officially out being 428 confirmed cases in the FCT does not include these numbers.
427 confirmed cases.
I got 428.
Oh, okay, fine. Yeah, it does not.
So it does not include those numbers?
It does not. Those numbers are, if the number depends on EPID number.
Okay.
Even if you transfer the person to wherever, the person still remains FCT patient. Okay. And if the person dies, it's counted against FCT.
Okay.
But that there is also a policy by federal government that we should not transfer patients from one state to the other for treatment. Wherever a patient is diagnosed, that's also a policy that has been circulated to all commissioners for health for the 36 states and FCT.
Granted, all states have treatment centers,
yes,
right? Maybe
all
some more than others.
Some have more than others. So you are supposed to remain where you are and present yourself to the state epidemiologist and then get transferred to the nearest treatment center and get treated. Okay. When you are okay, you can go back to wherever you're coming from.
Right.
So the next question is COVID-19 real? That's what I've been trying to say since I came to this studio. COVID-19 is real. It's real all over the world and it's real in this country. It's real in FCT. I've told you, we got 2 gentlemen that died. When we did postmortem tests, they are negative. What is confusing people is the people that are asymptomatic.
Yeah.
This is the problem. And we are getting asymptomatic because we are testing contacts. We are also testing the communities. If I got infected, God forbid, so all my family members are going to be tested.
Yes.
And all those that I have gotten in touch with in the office or wherever. So if one of them turns out to be positive, even if he doesn't have symptoms, he has the infection. He may not show symptoms because he has good immunity. Yes, strong immunity. But he is a carrier. He gives other people. So he spreads it. So that's why government's concern is to ensure that anybody that is tested positive will be kept in the isolation center and we are managed until you test negative before you are left into the society. So it's real. honestly speaking.
It has to be real.
Yes.
Madam Rita, somebody is telling you to ask doctor that they should include in their recreational sports, sports that will not require physical contact, such as, skating. Is entertaining, yes. That you should introduce skating in the isolation center. He didn't write his name. Okay, his name is Sylvester. Sylvester is writing from Asokro.
I guess he just did. But Doc is here to attend to one of the questions he had earlier.
So
the one about
it's an advice
in that market day, because I actually discussed that yesterday.
The market, yes.
And the crowd control and market day. We have just Wednesday. It sounds like when I used to live with my grandma. Now we talk about market days.
No, I tell people
Wednesdays
Igbo.
and
So I tell them
Saturdays.
that on Wednesdays is our Orie day. Then the Saturday is the Nkwo day. That's when the big market day is Nkwo.
Okay. Our one is a deki.
Yeah, okay. That's all.
Yeah, very big challenges. You have to factor in a lot of things.
Okay.
Yeah, in factoring a lot of things, you find that you do this, you find that you have some issues with this. You do the other one, you have maybe bigger issues. So in trying to get which one has the least problem, you find that people will still complain. Now, if you just say all markets should be open, there is no lockdown. Everybody will come to any time, go to market any time. How are you getting me? You are encouraging people to stay in their houses. How are you getting me?
Yes.
So, on film sitting, somebody wants to go to the market. But if you say, you can only go and get some basic things. In fact, the markets are only food markets.
Yeah, that's
that
true.
are essential and other essential like pharmacy and other things. It's not the usual markets where you go and do whatever. So you're supposed to sharp, go in, get whatever you want to go back to your house. How are you getting me? But it's also causing a log jam because markets are open once in a while, so everybody wants to go at the same time. But what we did in FCT is the GA market management, FCT, was directed to ensure that anybody getting into the market at the gate, you must wear your mask before you enter. You must have either sanitizer or wash hand.
Water.
In each store or wherever you are going in. Are you getting me?
Yes.
The people selling there must have their mask. Are you getting me?
Yeah.
Trying to ensure that basic preventive measures
Doc,
are in place.
I can tell you that is not happening. This guideline you just gave, that people should wash their hands before they enter the market, use hand sanitizers, those that are selling should have face masks, and it's not happening. I'm saying this because I've been to the market to do a report on this, and I've also spoken to people on a live talk show. It's a good plan from the authorities, but in actual fact, if you go to the market, today's Wednesday, that is not happening. And the reason why I think this is very important is, yesterday, like I said, I talked about this on my radio show. Perhaps if it is possible for the authority to increase the days from maybe 2 to 3 or 4, then me, for instance, I'm at work until evening, so Wednesday is totally out of the case for me. So on Saturday, everybody troops out.
Yes.
Because whether you like it or not, there are some, maybe vegetables that you cannot store for so long, you must go and buy. So the number of people, and because this regulation, actually, it's good you're saying it now. So the last time I was in the market, I had to accost the meat seller. Okay, why are you not wearing your mask? He said, I have, madam.
It's in my pocket.
It's in his pocket.
So it's an issue of
It's not like we sit there that some people
Rita,
will feel I'm just wearing it to please the authorities. They are not aware of the fact that it is for their own safety.
Richard,
Enforcement is another thing, right?
Enforcement is important. I actually found out something in FCT and indeed other places. The corner stores, the neighborhood markets, a lot of them are still open, which is good because they actually, observe the regulations. The shopping malls are okay. And I found out something very important. A lot of people don't want to go to shopping malls because they think it's more expensive. But within this period, I can assure you I've not gone to the market for the last 2 months plus. I have not. Yes, it's true. Because I do the neighborhood thing, and the shopping mall, and I found out they are actually cheaper in a lot of ways. Yes, I've also learned to do my
garden.
garden.
Pay you for this free publicity.
No, I've also learned to do my own garden.
Yeah.
What the water leaf I planted, it's working. The scent leaf I planted, they're all out.
Wow.
I've started using them 2 months now. You know, so if you begin to do a little bit of that, it works better.
So it reduces the number of times you have to go out.
One more thing, because the markets were open, it was easy for you to just walk in. You can buy, you know, everything, whatever you want every day. But now with what is happening, I have learned to have a book. I have my list in the house. So when onion is remaining 2 or 3, I write there about to finish. When this is remaining this, I write there about to finish. By the time it's Saturday that I'm going to have my chance, I always make sure I know what I want. For everything on my list, I know where I'm getting it. So I'm not going to sit down perhaps in Wuse Market for 1 hour.
I like that. That's,
you know,
shopping
planning
101.
Yes, I'm teaching you now.
COVID trained shopping.
Doctor told us earlier that when the doctors get into the words, they have a limited time to spend them. Maybe we should imbibe that mentality.
Write it down.
Spend maximum ABC minutes in the market. Get a list, know where you're buying what, go straight for it. And please, the seller, stop increasing prices. It makes us bargain for too long.
My director is on our neck. We have just 1 minute to leave. Doctor,
already?
What are your fears? The director is on my neck. Your fears?
My appeals. I prefer to say my appeals.
Okay.
My appeals are that people should understand that government is helping the society, because it's the responsibility of government to ensure that everybody is safe. People are getting infected. People are getting killed. We are lucky this pandemic has been very mild to us if you compare what we see happening outside the shores of this country. For those people that are even prepared in terms of infrastructure, health infrastructure. So our best bet is prevention.
Prevention is always the key,
yes.
Rita. Prevention is the key.
Prevention is always the key. That's our show for today. We have to go. We will miss you for the next 1 week, but make sure you stay safe. Wash your hands regularly. Keep
Or
social
you use your
distance.
sanitizer.
Or use alcohol-based sanitizers. Make sure they are original. We hear some of them at these days. Okay? Stay safe, because we need you to be here for us for another conversation next week. My name is Rita. Thank you so much, Lillian, and Doc. Thank you
so
for
much.
joining us. We hope when we call again, you will do us the honor.
Definitely.